I'm the first one. I'm a general gynecologist and always working in the front line. So that's why I'm the first one. And so today, this is my topic. So this is a question when I'm doing a general gynecology clinic, which is a private clinic, and patient can walk in or from referral. So this is a very common question when I found a fibroid in my patient. Okay, so let us discuss this topic. So are you sure that my fibroid is not malignant? So what we usually think about is, oh, don't worry, it's so common. 1 in 4 in more than 40 years old. It's rare to be sarcoma, about 3%. And you are not in those high-risk patients like all this. So the chance of malignant transformation is only 1 in 1,000. Okay, so although we told the patient about this, but at our hearts, we know that if we miss a malignancy and we morcellate the uterus or the fibroid, there's a risk of dissemination of the malignancy. And sarcoma is also disastrous because it's resistant to any adjuvant therapy, chemo, or radiation. So a disaster do happen in 2014 where there's a death of an undiagnosed disseminated larval sarcoma after laparoscopic myomectomy. And at that time, FDA warned against the use of power morcellation. So in Hong Kong, at that time, we really cut our surface and throw away our morcellators. But it is important, so we think about, we cannot do it forever. So it's important to distinguish a sarcoma from an ordinary fibroid, but it's very difficult, but important. So how rare it is? So this is one of my patients and my friend who come to me with postmenopausal bleeding in December 2020. And at that year, in May, she has an ultrasound done with a multiple fibroid. The largest one is only 3.5 centimeter. She come to me and I do an ultrasound again. In January, it is a very vascular fibroid, and it's a kind of grade 4 Doppler intralesional. And so I highly suspect she has sarcoma and then refer her to the oncologist. And surgery was done, and it's all like this. So you know it's a very atypical fibroid. You see, so ugly. Okay. So I just look back. Is there any clinical predictors that we predict a sarcoma before surgery? So I think some of you may know about this press score. This is the first one who try to predict whether the fibroid is a sarcoma before surgery. They use the age, the LDH, and also a positive endometrial biopsy and MRI, and they each score 2, and this only 1. And afterwards, there's some other scores using similar things, but ultrasound features. And when the Chongqing HIFU come to Hong Kong in about 2019, so it's totally non-invasive. So I just think if you are totally non-invasive, you must have a good screening method to screen out the malignancy. So I just look at the figures, what they do. They use the diffusion weighted MRI, and also they put in some paper. So I just want to look back all these scoring algorithm, and complicated one. But any of you use any of this? I think in Hong Kong, not much of us doing because too complicated to be used clinically. Okay, so I try to analyze what happened to my clinic for 5 years. So since 2016 to 2021, there are totally 2,237 records. I just look back, and excluding all the non-Chinese and all those we found malignancy at the same time. So after exclusion is 2,050 records was reviewed. So you know, only after 2019, we used the LDH and also the MRI screening. And before that, we just used clinical. So, okay. So what happens on this record? I just look back. So actually for 2000 records, 2015, 10, I clinically suspect sarcoma. And 1, I referred to her to the oncology. After the first visit, it's confirmed sarcoma. And 4, I do tell the patient, but they lost follow-up, maybe too frightened, and they go away. I can't trace back. And 5, I finally got her to do an MRI. So for the 5, I suspect clinically, 1 is benign, and I do the hysterectomy is also benign, is confirmed. But for the 4 sarcoma, I suspect 2 actually after surgery is a benign, and 2 is a sarcoma. But it may not be a surgery, but it's a pathological diagnosis with endometrial biopsy confirmed. Okay, that is what my clinic happens. So I found 7 clinical predictors. So, and the incidence of this study, of my personal study, is only, the chance of it is only a sarcoma is 0.19%. And for this, got a higher score than the average, which is not sarcoma. Okay, so don't memorize anything. Yes. So I think that I say the 7, you may think about it, is the age. Suppose a patient who is 49-year-old, got a very big fibroid, more than 10 centimeter, rapid growing, increase after menopause, just like the first one. It's a bit bleeding, abnormal, whatever bleeding, and also very vascular, and you found a very high LDH. So bingo, you may see a sarcoma, better not modulate or refer. Okay. So, but how about those which I don't think is a sarcoma? I do miss one. It is a stage 1. It's only diagnosed after hysterectomy, which is a 40-year-old, and she present with me with small fibroids and with some spotting or bleeding. So I do an endometrial biopsy in 2015, and it was negative. I put in a Mirena. It worked for about 6 months. Yeah, 6 months. And suddenly she has very profuse bleeding. Yes. And then so I think, oh, maybe Mirena is not working, or I do the DNC and also removal of the Mirena. But 3 days later, I have to do the hysterectomy and found it's a sarcoma. Grossly looks so good, but it's sarcoma, but it didn't spread out. Okay, another very challenging question. We do find something, but suddenly this question from one of my patients. Okay, be quick. 30-year-old, single, menorrhagia, anemia, and then she has a fibroid for some time. She has to be on hormone for some time, since 2014. She want a HIFU because she want to get rid of the hormone. It's too sick for her. It's not working well. So I do the ultrasound, similar, smaller, multiple small fibroid, a very vascular, a bit vascular, and a high LDH. So, but the HIFU was declined because it's too difficult, too vascular, after the MRI. So I do this one. So this is her MRI. So I do an open adenomyoectomy and take out all these things. It's all like this. It's a degenerate fibroid with adenomyosis. Oh, okay, story finished. So I do check up on her with ultrasound. She's asymptomatic, get rid of her hormone, but the uterus size is gradually increased about 1 year. And in 2022, last year, suddenly an orthopedic surgeon found she has a very big uterine mass, and I do the MRI again. Maybe I back. Okay, this one. So what happened to her? I just try to figure out. She has a large fibroid in the ultrasound, anemic, and it must be a rapid growth, and also a very high LDH, 320. So the patient, I'm suspecting sarcoma, the patient don't believe in it. So I say, maybe we do an MRI again. Okay, so this is next. So ugly, aggressive, with metastasis already. She finally has a hysterectomy done, and then she's on chemotherapy. Okay. So when I look at Hong Kong, I come from Hong Kong, the uterine malignancy is the 6th among all malignancy. So it's increasing in trend, and also we don't have much improvement in the survival benefit. We do very good with cervical. It's all along like this, not increasing. It's the lowest one. Highest one is the uterus, and the ovary come the second. So, okay. So we all know, for uterine malignancy, a much older, 55-year-old, but unfortunately, we got a very young one, 15-year-old with uterine cancer. A headache for us. Okay, so let's look. We do some statistics from the Department of Health. So actually, 87% is adenosarcoma from the endometrium, but 3% of sarcoma. But you see all this, some we don't know, or others, or some we just diagnose clinically. Why? Because usually late. So the survival is usually age, we know age and stage. Okay, all this. But not much improvement in the survival for uterine malignancy in Hong Kong all these years, 10 years. So this is I just see if anybody, I pose up some questions. So for the clinician and the frontline docters, we need to develop a very simple predictors. Is my 7 predictors useful? You may think about it, or somebody I hope it is useful. And we have a better develop an algorithm of a very early non-invasive treatment of the uterine fibroids. Because we got a younger patient with fibroids and also adenomyosis. And so I think about, is the non-invasive HIFU useful? So we kill some of them and preserve their fertility and decrease the chance of turning to sarcoma. Okay, is all this reference? So I think, so hopefully the one next to me will discuss more about this and give me some feedback. So I still think when there's a will, there's always a way, and hope for the answers. Thank you very much.
Thank you for your very nice lecture.